Hello dear aspirants, in this video we are going to decipher the strategy for conservative dentistry or the operative dentistry. Now this conservative dentistry is one of the easiest subject, or we can say the shortest subject to read. Okay, why I'm saying this? Because we have practiced enough of the conservative dentistry or the operative dentistry in our college life right from the beginning of our career, or we can say from the second year onwards. We were doing a lot of clinical things, right? And then after third year we have turned to the practical approach, right? So the first thing which makes this subject easier is the enough exposure in our clinics. The second thing, this subject is interesting. Why? Because there are a lot of advancements which have been made in this field of the instruments, or in the field of the newer technologies, newer materials. So if we read those out of getting benefit in your clinical practice also, then also this becomes an interesting subject. And the third thing, this subject is overlapping. A lot of materials, the cements, the bases or liners which we are using can be read in dental materials, and that's why the workload here of cramming a lot of information gets reduced. So the three aspects which make this particular subject easier is enough exposure, the advanced things, the interest for knowing the advancements in the dentistry, and of course the overlapping nature, because a lot of things, for example amalgams, for example different cements, are being covered in other subjects where we can cram these and we can have a good hold on this particular subject. Coming to the weightage of this particular subject, yes, the weightage is around 7 to 8 subjects out of questions out of 240 questions, and this accounts for almost 3% of the total NEET examination paper. And these 7 to 8 questions are very easy to concur upon, and this will be giving you a better strategy or better marks gaining capacity in your exam. So do not underestimate this particular subject, and it's of course a low hanging fruit. You can try grabbing this, right? So if we see the previous year analysis of the weightage of this particular subject, in 2016 there were 7 questions, in 17 there were 5, then 6, then in 2019 there were 6 questions, and last year 2020 there were 8 questions, and in 21 also there were around 7 questions. So almost 7 questions which are directly from this particular subject. We are not adding the questions from the dental material aspect or other clinical aspects. We are just considering the direct question which are solely based on this particular subject, that is your conservative dentistry or operative dentistry. Now coming to the books for the conservative dentistry, and there is only single source for your conservative dentistry, that is Students. Now if you have less time, you can always refer the Students Art and Sciences of the Operative Dentistry, which was edited by V. Gopi Krishna, or the ideal way to prepare this particular subject is referring the original Student. Okay, so this is an South Asian edition. Always the complete international edition is preferred over the South Asian edition, although the South Asian edition carries a very good compilation of images. But yes, you can always go for the international author, because a lot of things have been trimmed from this particular subject when they are making the South Asian edition. Or the alternate is of course reading our bites. We have compiled every important information which is pertaining to the INI-CET and your NEET examination, and we have compiled in such a way that it becomes very comprehensive for your reading as well. So you can always refer any of the edition of the Student, or an alternate is there if you want to use the time, the short time efficiently. You can always go with the bites. So we have bites in which we have extensively covered the important topics only. The first one is principles of cavity preparation, then liner species, amalgam, direct filling gold, dental bonding agents and composites, as well as other techniques, inlay, onlay and all. So we'll be discussing the details of these topics separately now. So you can always use the bites in the efficient way, and you can cover the whole syllabus in a small fraction of time. So it is recommended that you read bites about the conservative dentistry thoroughly. Then comes our task. So the first task is the principles of cavity preparation. Now this principles of cavity preparation is something which you have been reading from the second year of your college life, right? So principles of cavity preparation for amalgam, you have read it extensively in theory, as well as you have practiced a lot from third year onwards. Then only inlay, the theory you should be very much clear with. And what are the differences of cavity preparations of composites and amalgams, the cavity preparations for direct filling gold, all these things have to be very clear. Unfortunately, a lot of questions are not asked on this aspect nowadays. If we analyze last 5 years, hardly few questions are asked from this particular subject, but this forms your this topic forms the basis of your conservative dentistry. So you should have a very good hand on these this particular topic. Then the second thing is amalgams. Now amalgam is dealt in detail in your dental materials. Here we are basically focusing on the operative aspect or the conservative aspect of the amalgam. So basically cavity preparations and different kind of amalgam, different kind of retention, right? All those things we are discussing an amalgam here. Then we have the direct filling gold. We have discussed the enough amount for the question which can be asked in your exam. Then we have dentin bonding agent and composite. So this dentin bonding agent and composite is very hot topic for this particular exam, and at least one question, one is very less actually, 2 to 3 questions can be asked on the dentin bonding agents as well as composites. So here we have discussed about the dentin bonding agents in details, all the generation of the dentin bonding agents, the historical aspects of the dentin bonding agents, and the materials and the the whole composition of different kind of dental bonding agents, the bottle systems, everything have been explained very beautifully in the bites. So you have to have a very good. Then comes the composites. Of course, here we have discussed the principles of cavity preparation of the composites, and then we have discussed basics about the composites. So this is something which is important, and this can be revised in the dental materials also. Then we have liners and bases. Here our whole discussion in the bites as well as the tests also, we have focused mainly on the liners and bases here, while the cements, the other cements have been discussed in details in your dental material. Then instruments. Now instruments is the second thing after dentin bonding agent and composites, which is being asked a lot in the exams like NEET. Okay, so the type of instruments, hand and rotary instruments, then the abrasive and newer instruments, then laser and recent advancements in dentistry. Now these 3 topics are really very important. They have been very beautifully covered in the bites, and you have to cover these instruments. And nowadays, if you think about the INI-CET, they are picking questions from the recent advancements in dentistry. Although the NEET is picking questions from the basics, but yes, advancements can always be asked. Then the next topic is rubber dam. This is something which has been advised and has to be dealt in depth. Then we have image based and case based tasks in for you to have a good hold on the different type of instruments, different advanced instruments, and other features of the cavity preparation and all. We have compiled a lot of images to give you a good idea of this. And of course, after that, the full syllabus test to check you comprehensively on the hold on different tasks. So these are the task list. Very small task list is there, and this whole thing can be done within a 4 or 5 days are enough to complete this. So if you are dealing with some larger or lengthy subjects, you can always put this particular subject in your task list so that you can get a break and you can get more confidence, right? So this was all about the conservative dentistry. So the whole approach about this is knowing the advancements, knowing the different type of instruments, and getting a good hold on the dentin bond agent as well as your composites. And of course, reading principles of cavity preparation is basically the brushing up of what you have read in your undergraduation. So this is all about the conservative dentistry.